Hello friends, today let's discuss the topic effects and uses of therapeutic modalities in rehabilitation, cold therapy, hot moist, infrared, contrast bath and wax bath therapy. Let's start with the introduction. Rehabilitation is the utilization of the existing capabilities of the differently able person by the combined and coordinated use of medical, social, educational, and vocational measures to the optimum level of functional ability. To complete a proper rehabilitation program, certain electrotherapy modalities are employed. Electrotherapy can be defined as a treatment of patient by electrical means. By implication, this means that electrical forces are applied to the body, bringing about physiological changes for therapeutic purpose. However, in addition to these external forces, electrical charges are generated within the body by normal physiological process. Between these two sets of electrical forces, there will be interaction between the changes that occurs as a result of the body response to the injury and any applied therapeutic agent. First, cold therapy. Cold therapy or cryotherapy refers to the use of local and general body cooling for the therapeutic purpose. This can be classified into first, local effects, and second one is general effect. So let's start with the local effect. Local effects of cold therapy . The speed with which this vasoconstriction occurs indicates that it is a reflex in the autonomic nervous system, which is triggered by stimulation of the thermal receptors in the skin. After some minutes, the vasoconstriction may give way to a marked vasodilatation, which itself may last some 15 minutes before being replaced by another episode of vasoconstriction. This alternation of constriction and dilatation is called Lewis-Hunting reaction by Lewis in 1930. It serves to protect the tissue from damage due to prolonged cooling and ischemia. Hypertonicity. If the cold is sufficiently intense, it reduces the conduction velocity of peripheral nerves. And the fifth one is on the motor system. Muscle strength of motor skills are diminished by cooling, probably because of its effect on viscosity and metabolic rate. The next topic is general effects of cooling. Cooling applied to the skin immediately stimulates the cold receptors, which are more numerous than heat receptors in any given area of skin. The hypothalamus acts as a thermostat to maintain core temperature. The posterior hypothalamus is concerned with the response to body cooling being affected by the nervous input from the skin as well as the blood temperature. To conserve heat, it is responded by cutaneous vasoconstriction and by increasing blood flow to the skin through vasodilatation. And next, and here comes the method of applying cold therapy. Cold therapy can be applied in terms of force. Hot moist therapy refers to the application of hot water to the extremity by dip and wrapping method. It can be done with hydrocollateral packs. This hydrocollateral pack by an electric heater controlled by a thermostat. It takes about 2 hours to become fully heated from cold but less when reheated. And here comes the method of application of is to achieve the required heat. And here comes the infrared rays. Infrared rays are electromagnetic waves with wavelength of 750 nanometer to 1 millimeter. Any hot bodies emit infrared rays such as the sun, gas fire, coal fire, electric fire. Treatment with a luminous generator is often referred to as radiant heat. The term infrared generally applies to the radiation from non-luminous source. And infrared rays. At the commencement of the exposure, the intensity of radiation should be low, but after 5 to 10 minutes, when vasodilatation has taken place and increased blood flow has become established, the strength of the radiation may be increased. This can be achieved by moving the lamp nearer to the patient or by adjusting the variable resistance. At the end of the exposure, the skin should be red. Following extensive irradiation, the patient should not rise suddenly from the treatment position. And here comes the therapeutic uses. Infrared therapy should not be used in case of impaired cutaneous thermal sensation. Second one, defective arterial cutaneous circulation. Third one, patient whose level of consciousness is markedly lowered by drug or diseases. And fourth one, acute skin condition, for example, dermatitis. And the fifth one, skin damage due to deep X-ray therapy. And next one, defective blood pressure regulation. And next is acute febrile illness. And last is tumors of the skin. And here comes the next topic, contrast bath. Contrast bath involves alternate immersion in hot and cold water, producing marked hyperemia of the skin. Such treatment will cause considerable sensory stimulation as the cutaneous hot and cold receptors are alternately activated. This stimulation is relatively vigorous because each time neural accommodation starts to occur, the temperature stimulation is reversed. Method During the treatment, the hot water will cool and the cold water will be warm, partly due to the transfer of the warm and cold limbs from one bath to another. It is therefore necessary to monitor the temperature with a thermometer. Next topic is therapeutic uses of contrast bath. First one is to relieve pain, and the second one is helps to reduce local edema. And the next topic comes wax bath therapy. The paraffin wax melts at around 54 degrees Celsius, but this point can be lowered by addition of mineral oil such as liquid paraffin. Most wax baths are kept at temperature between 42 to 52 degrees Celsius, often at a higher range for hand treatment and rather lower for the feet. The wax is maintained molten in stainless steel or enameled bath, which are electrically heated. Temperature is kept constant by the thermostat. And the next topic is method of application of wax bath. The part this usually takes 4 to 6 immersion. Wax gives off heat slowly due to its low thermal conductivity, but after removal from the bath, the part cools quickly. In order to retain the heat, wear the part in a layer of plastic sheet or a towel. Treatment is usually given for about 20 minutes. After this time, impaired skin sensation. The conclusion of today's topic. From the above discussion, it is well known that electrotherapy modalities are of big help in the treatment of patients with different problems. If the modalities are well understood, there can be a wide variation in acceptable technique and treatment within the confines of safe and effective practice.